everyone, and welcome to another episode of A Day with a Fertility Specialist. I am Kajidi Sabina, and I'm your host for today. And joining with us in the studio today is Dr. Ulubi Deborah, our IVF specialist here at ours. She's the IVF coordinator at ours and a wonderful family doctor. Welcome, Dr. Deborah.
Thank you very much, Sabina.
Nice to have you here today.
Thank you very much. Good afternoon, viewers.
And today we'll be talking about endometrial rejuvenation, improving implantation. When a woman comes to the hospital for IVF screenings, IVF tests, or the IVF procedure itself, there are a lot of tests we carry out at first. We look at the woman's holistic body in the first place. We look at the ovaries, we look at the endometrium. But a lot of people hear this endometrium and don't really know what it is. So could you explain what the endometrium is in a nutshell, in layman's terms?
All right, thank you very much. So, a woman's uterus, in layman's terms, the womb, where pregnancy happens, has different kinds of tissue. The inner lining is called the endometrium, and that's where implantation of pregnancy happens. So that part is very important. It's different from the muscle layer where you could have fibroids and so on. But the innermost layer, that's the part that responds to the hormonal changes in a woman's menstrual cycle. That's the part that sheds when a woman is menstruating. And that's also the part that supports an embryo to be implanted for the pregnancy to occur and then for the baby to start developing. So that inner lining of the womb, that's the endometrium.
Wonderful how just one part of the body has a lot of roles it plays in production and infertility. So when you say rejuvenation, what does it really mean?
Yeah, so when you say rejuvenation, you're trying to make something better. Yeah, in this case, endometrial rejuvenation, we're trying to stimulate new endometrial tissue to grow in the lining of the womb. Maybe because there has been some damage or what we call scarring in that part. So scar tissue is not the normal endometrial tissue. That tissue will not respond to the hormones. Like I mentioned, the endometrium responds to the hormonal changes in the woman's body throughout during the menstrual cycle. But the scar tissue will not respond because this lining is supposed to grow and there's a time that it sheds. That's when a woman is menstruating. Then it starts building up again, growing again. And it's that process, that functionality that helps to support pregnancy. So when there are issues of damage like scar tissue, that could happen for various reasons, the lining does not respond normally to the hormones and doesn't grow. And that kind of tissue cannot support pregnancy. So in situations like that, endometrial rejuvenation is something we do to improve the function of the lining and to cause new tissue, new endometrial tissue to develop that can respond to the hormones that it should respond to and grow as it should grow.
Okay, thank you, Dr. Debbie. You mentioned scarring.
Yes.
What is one of the causes of endometrial scarring?
Okay. So there are lots of causes. And one of the major causes is when there are instrumentation or procedures on the womb. For example, women that have dilatation and cruelty, that's what we call D&C, or evacuation due to maybe a miscarriage or sometimes termination of a pregnancy, that can damage the normal tissue if it's overzealously done. If it's overzealously done, it can damage the normal endometrial tissue. And when there's a damage, just like a wound, when you have a wound, how does it heal? It heals with a scar. And that's the same thing that happens in the endometrium. So that place heals with a scar, and that's not the normal lining. And the scar will not respond to the hormones. And then another thing that will cause scarring is when we have infections. Infections, either pelvic infection, vaginal infection that ascends up into the uterus, that can also damage. Severe infection will lead to scarring of the lining. So that can also damage the lining. And then also some other uterine procedures like a cesarean section or a fibroid surgery where the lining is breached. All that can damage the lining of the womb. And then some people that have radiation therapy and they have to have pelvic radiation for maybe to treat the cancer somewhere, that can also damage the lining of the womb.
So you are saying that all these damages, all these scars, anyone can be fixed by endometrial rejuvenation?
Yes, that's what endometrial rejuvenation attempts to do, to return the endometrium as much as possible back to its functionality.
Wow, today. This session promises to be a very insightful and interesting one. So I want you to send this link to somebody you know. This session will be very helpful. To send it to your friends, send it to your family, let them join us. And if you have any questions, you can drop them in the comment box below, and we'll try our best to respond to all of your questions. So now, People hear endometrial rejuvenation and think it's something painful or like a very invasive procedure. Could you describe how this procedure is carried out?
Yes, thank you very much. So endometrial is a minimally invasive procedure. It's a day procedure. It just takes a few minutes and the woman is out of the theater and then you can go home. Yes. So what happens is that the client's blood is taken. So that's what we use to generate the platelet-rich plasma, the PRP, which is what we use to inject into the lining of the womb to stimulate. That's because the platelet-rich component of the blood has a lot of growth factors that stimulate the lining, to grow. So that's the aim of endometrial rejuvenation with PRP. So the woman is taken to the theatre and then using a stethoscope, this fluid PRP is injected into the basal layer of the endometrium to encourage new endometrial tissue to grow. So in that way, it heals the scarred area and it causes new tissue to grow. So that's what endometrial rejuvenation aims to do.
Okay, so I heard that this scarring in the
Yes,
endometrium could be one of the causes for recurrent losses,
yes.
recurrent, yes, implantation failure when it comes to IVF. So how do you think this endometrial rejuvenation could help tackle that problem?
Yeah, so that is one of the reasons for why you could have recurrent pregnancy losses or implantation losses. That means following an IVF, pregnancy is not even happening. And sometimes when pregnancy even happens, the miscarriage happens early on in the process because the lining is not able to support. I told you, this lining, the inner lining, is what supports the embryo to embed. The embryo now gets nourishment from the lining. So the lining is not able to support this. So pregnancy will not happen or a miscarriage will happen early. Yeah, so endometrial rejuvenation, the aim is to attempt to help, to stimulate the endometrium to produce and develop new endometrial tissue, which will be healthy and then be able to support pregnancy and then growth of the embryo when pregnancy happens. So in that way, it helps to prevent recurrent pregnancy losses or recurrent implantation failure.
Okay, so for which patients do you recommend endometrial rejuvenation for? Is it everybody that comes for IVF, or you might have seen something in the scan, or maybe after implantation failures? Is that when you recommend endometrial rejuvenation?
No, so endometrial rejuvenation is not recommended for everybody. Yes, so usually from the scan, you can see features that suggest scarring in the endometrium, but the diagnostic thing you need to do to really diagnose, scarring in the endometrium is a hysteroscopy. So
Okay.
hysteroscopy can be both diagnostic and therapeutic, and that's the beauty about hysteroscopy. So at the same sitting, when this diagnosis is made that this woman has scar tissue or adhesions in the lining of the womb, it can also be treated at the same sitting via hysteroscopy. So via hysteroscopy, this scar tissue can be removed. For some people, depending on the degree of damage or degree of scarring, just hysteroscopy and adhesiolysis via the hysteroscopy, that's the process of removing the scar tissue, is just enough. And then you place them on medications to encourage the normal buildup of the endometrial tissue. That is fine. But if the degree of scarring is so much, then those are the clients that are candidates for endometrial rejuvenation. So a woman that has had recurrent implantation failure or IVF failure, and from her monitoring scans, you notice that the endometrium doesn't build up because there's a normal buildup of the endometrium that we're comfortable with. Usually
Okay.
between about 7 to 14 millimeters, you're comfortable. This does
Okay.
not mean that pregnancy cannot no happen at endometrial thickness of less than 7 millimeters. Pregnancy can still happen, but what we are more comfortable when it's within that range I mentioned. So a woman that is having an endometrial thickness that is less than 7 and pregnancy is not happening, you want to dig deeper into this. So she might be a candidate for endometrial rejuvenation to try to improve the lining so that it responds better, to the hormonal medication she's given.
Okay. So I know a lot of us, especially in this part of the world, Nigerians, we believe that not everything can be solved by doctors. That sometimes we need to
Mm,
go the herbal way, the
okay.
natural way, as they say. So, what do you suggest for women who are trying to build their endometrium naturally, or is the all answer endometrial rejuvenation?
Yeah, so it depends. Like I said, it depends on the degree of damage. Yeah, but a healthy lifestyle helps anything. But if they are really scarring in the endometrium, so it's a hysteroscopy and plus or minus a endometrial rejuvenation that will address, that will address that.
Okay, so what expectations should patients have after an endometrial rejuvenation?
Yeah, so the expectation should be for a positive outcome, that it will improve, it will improve their endometrial health, lead to the endometrium growing, better. So that's the expectation. The expectation is that this will provide a solution to whatever the issues, might be. So they should be optimistic about it. We've had
Okay,
quite some excellent results from endometrial rejuvenation. Yes.
okay,
So if they're counseled to have it, they should be open to having it.
okay. Is there an age limit to which you would advise endometrial rejuvenation be done?
No, there's no age limit. If the candidate merits it,
Okay,
and then intrauterine adhesions, that just hysteroscopy alone, adhesiolysis is not able to deal with, and the client is counseled for it, they should have it.
okay. So, what other medical issues does endometrial rejuvenation solve aside implantation failure? Does it solve any other one?
Yeah, so it could, yeah, so for fertility, it could help with implantation failure. Now, for people that, some people that might not be, one of the things that happens when the adhesions is that a woman might stop seeing her period. She might not be
Okay,
menstruating again because, like you said, scar tissue will not respond to
to
those
the
hormones, or
hormones,
the
yes.
the flow will be much reduced, because that
Okay,
means maybe just few pockets of healthy endometrium. So for a woman that is not menstruating again, due to intrauterine adhesions, so endometrial rejuvenation might also be the way out for her to restore the normal endometrium that is able to respond to the hormones, so that she can, start having a normal menstrual flow. So
wow.
it can work for that too. Yes.
Wow. So, dear viewers, you can see that this endometrial rejuvenation is not just targeted at our IVF patients. It could also be for you.
Mm.
Probably you notice one or two issues regarding your normal monthly cycle. You come to the hospital for a consultation, and we'll see if you're a good candidate for endometrial rejuvenation. So, have there been any cases of poor responders to this endometrial rejuvenation?
Yes, definitely. The degree of damage is different. So it depends on the degree of damage. Some people might even need to have more than one session.
Okay.
Yes, some people might need to have more than one session. So you've had a session, we've monitored and we see that the build-up of the lining is still not as adequate. We could cancel that, you should have another session. And definitely there might be some damage that, despite all your attempts, the endometrial rejuvenation is an attempt to repair something that is damaged. Yes, sometimes this attempt doesn't work because of the extent of damage that's taking place already. And that's why, we talked about what could lead to scarring of the endometrium.
Endometrium, yes.
So people should make sure, people having termination of pregnancies, even evacuation, D&C, should be done by experienced hands, not just by
Okay.
anybody. I talked about people being overzealous, and in the process of removing the
Damaging.
retained product of conception, they go to damaging the basal layer of endometrium, where the endometrium is rejuvenated from. So avoiding those things that put you at a risk can help. And then even when you notice you have vaginal infection, pelvic inflammatory disease, let it be treated adequately. We talked about
Okay.
infections being a cause of damage carrying in the endometrium. So those are some of the proactive things that people can do to prevent themselves falling into, this issue of having carrying in the lining of the womb. So those are some of the things people can do.
Okay. Thank you very much, Dr. Debbie, for this wonderful and
Thank
very
you.
insightful session. Takeaways from this session. She also mentioned pelvic inflammatory disease as one of the causes of scarring in the endometrial lining. So, if you're having any symptoms, do not just stay at
So
home and do
self-medication,
exactly.
herbal concoction, please
It
see
will
a
not work.
doctor. Yeah.
Just try to see a doctor as soon as possible. And for anyone wondering, we render all these services here at ALPS, the stereoscopy, the endometrial rejuvenation, all of it, including our IVF services. So whenever you are in need of these services, you can come down to our hospital, either at Jos here or in Abuja. So that will be all for today, Dr. Debbie. Thank
Thank
you
you.
very much for
Thank you,
answering our
Sabina.
questions.
Thank you for having
Um,
me.
if you have any questions or you'd like to consult with our doctor, there are numbers displayed down on the screen that you could give a call for a consultation, or you come visit us at the hospital, and we'd love to see you anytime. So till next time, thank you very much and have a nice day.